Hi, Miss Napoleon. I'm Dr. Hamilton. I was brought in because you came into the emergency room, and from what I understand, they suspected that you had possible alcohol poisoning. I took some notes on kind of what you spoke to the charge nurse about, and you just said that you had a really long night. You drank, but you're not sure how much or what else was going on. Um, Miss Napoleon, when we did the blood work on you, some things came back. But it's okay. A lot of the things that came back in your blood work could be prescription medications. Okay. This isn't, we're not taking you to jail. We're not calling anyone. We just need this for your medical record. We want to make sure that we're going in the right direction. So I'm going to do a quick assessment on you. If I ask you a question about a substance and you know that you take prescription medication, I'm not including that. Okay. So what I'm going to do is I'm just going to assess your alcohol, smoking, and then substance involvement. It's just frequency and concern. There'll be some stuff on here, some prescription drug stuff. I'm going to ask you about it, but if you're taking it as prescribed, I don't want you to include it. If you feel like you may misuse it sometime, if you take a little bit more, you take it when you're not supposed to, I want you to include that. Are you following? Is everything?
Yes.
Okay. Thank you so much. Okay. So what I'm going to ask you is this is going to be in the last 3 months. Okay. I'm asking you for things that have happened in the last 3 months. The first thing I'm going to ask you about is tobacco. Have you used tobacco in the last 3 months?
Yes.
Okay. Would you say that you've used it 1 to 2 times, 1 to 3 times a month, 1 to 4 times a week, daily?
1 to 4 times a month.
Okay. 1 to 4 times a month tobacco. Okay. And has anyone in the last 3 months shown concern about your use of tobacco?
No.
Okay. Have they said anything like, you should really stop smoking, or, smoking's bad for you, anything like that?
Not with tobacco.
Okay. Thank you. Okay. And we're going to move to alcohol. So, alcoholic beverages in the last 3 months.
Yes.
Okay. 1 to 2 times in your lifetime, 1 to 3 times a month, 1 to 4 times a week, or daily?
1 to 4 times a week.
Okay. Okay. Okay, and I'm just taking notes on a couple of things. Okay, and this is a follow-up question for the alcohol question. How often in the last 3 months would you say that you've had 4 or more drinks on any one occasion?
Maybe about 10 times.
10? Okay. Okay. Okay, and we're going to move on from alcohol. Now we're moving on to marijuana. Now, I'm going to ask you in the last 3 months, 1 to 2 times in your life in 3 months, 1 to 3 times a month, 1 to 4 times weekly, or daily?
Daily.
Oh, okay. I appreciate your honesty. Okay. And has anybody in the last 3 months shown any concern about your use of marijuana?
Yes.
Okay. So, yes, in the last 3 months, someone has shown concern, or yes, but not in the last 3 months?
Both.
Okay. So we'll just go with the last 3 months. Okay. Okay, we're moving on to amphetamines. So this is kind of we're getting into the frame of mind of things that may also be prescribed. So when they're saying amphetamines, they're talking about speed and things like that, but they're also talking about like Ritalin, Adderall. So are you prescribed any of these medications?
I am prescribed Focalin, which helps with ADHD.
Okay. So you take that as prescribed?
Yes.
Okay, so we're not including that. Are you taking any amphetamines recreationally?
From time to time.
Okay, so in the last 3 months?
Yes.
Okay. Once or twice in the last 3 months, 1 to 3 times monthly, 1 to 4 times weekly, or daily?
1 to 3 times monthly.
Okay. All right. Any cocaine or crack use in the last 3 months?
No, ma'am.
Okay, and back to the amphetamines. Has anyone in the last 3 months shown any concern about your use?
No.
Okay. Okay, we're moving on. Sedatives and sleeping pills. So when I say sedatives, I mean benzodiazepine. So I mean like Ativan and Xanax. I'm also talking about Ambien, those kinds of drugs that basically make you sleepy or they're considered downers. Any of those in the last 3 months?
Yes.
Okay, and once or twice, 1 to 3 times a month, 1 to 4 times a week, or daily?
1 to 3 times a month.
Okay. And we're talking recreationally.
Well, I feel that I need to take it.
Are you prescribed them?
Yes.
Okay. So you're prescribed them. Are you prescribed them PRN?
Yes.
Okay. So then we're not going to include those because if you're taking them 1 to 3 times a month and they're PRN, that means as needed. So if you're taking them then you feel they're needed. So we're not including that.
Well, I want to be honest. I have taken some amphetamines that are not prescribed.
Okay. Okay. Amphetamines or we're on sedatives? Because amphetamines, you said you have. So we've gotten it. You told us about the amphetamines. The sedatives, like Xanax or a sleeping pill Ambien, you've taken recreationally?
No, ma'am, but I have taken some somas
Okay.
recreationally.
Okay. One to twice in the last 3 months?
Yes.
Okay. Thank you. I appreciate you letting me know that. Okay. And anyone shown any concern in the last 3 months about those?
No, because no one knows. I've kept it to myself.
Okay. Thank you. Just put a little note. Okay. Moving on to prescription pain medicine or heroin. Either one. And when I say that, if you're prescribed hydrocodone or if you're prescribed Vicodin or any Oxycontin, and you're using that for pain prescribed by your doctor, I'm not talking about that. I'm asking about if you're using it more than you think you should, or you're just using it for the high of it in the last 3 months. Have you had any occurrences?
Yes.
Okay. Have you had any occurrences 1 to 2 times in the last 3 months, 1 to 3 times monthly, 1 to 4 times weekly, or daily?
1 to 3 times monthly.
Okay. And in the last 3 months, has anyone shown any concern?
No.
Okay. Okay. And lastly, this is just other recreational drugs. So I'm speaking of ecstasy, Molly, any inhalants, hallucinogens, LSD, any mushrooms, anything of that nature. Have you had any in the last 3 months?
Yes.
Okay. And what would you consider part of the other category?
I've had ecstasy
Okay.
and Molly.
Okay.
I've abused Soma pills.
Okay.
For my PRN with my Ativan, I've taken more than the half tablet.
Okay. But do you feel, since it's PRN, I know you're prescribed half for when you need it, but do you feel like it was needed or do you feel like you were just taking it for the high?
No, I feel like with the Ativan, I was taking it as needed.
Okay. You felt like that what you were prescribed wasn't enough for that particular time that you took it.
Well, my doctor said take a half pill as needed, but
Uh-huh.
it's been times I've taken two because I've felt overwhelmed and I felt like I needed to kind of balance out that feeling.
Okay. That's kind of that's kind of in a murky gray area because I know that, especially with the PRN prescription, you may take it once a month. You may be prescribed half, but if something is overwhelming, you're not taking it to party or you're just feeling badly enough. Okay. We'll just put a star by that. Um, so the other category, so ecstasy, Molly, and you've had ecstasy or Molly one or two times in the last 3 months.
Yes.
One or two times.
Yes.
Okay. And in the last 3 months, has anybody shown concern about your use?
No.
Okay. Okay. So just give me 1 minute. I'm just going to add up your scores and then I'll discuss with you what they mean. This isn't going in your record. This isn't getting sent to police. This is just for me and you to discuss and possibly make small changes. I'm not asking you to run out of here and be sober, and that would be wonderful. But if we can just make some small changes to, what's going on in your life, you may see a big difference. The last thing we want is for you to be back in here with alcohol poisoning or worse. So that's all we're trying to prevent. So let's see. So we have three. Excuse me, it takes me a long time to add things. Okay. So the score I'm getting is 29. And I'm going to separate that actually. So the alcohol will be separate. The alcohol is 14. So really we have 25 for the others. Okay, so let me just give you an idea of what the scores mean. Just to reiterate, the assessment that we did was the alcohol, smoking, and substance involvement screening test, frequency and concern. It's called the ASSIST. They separate alcohol and substance abuses, um, mostly because alcohol is legal, and also some people just have a drink or two. They don't have an issue with it, or some go to Vegas and party for the week and they don't have an issue with it. So we need to separate that from other substances. Um, Low risk for alcohol would be 0 to 5, moderate would be 6 to 8, and high would be 9 to 12. Um, your alcohol is at a 14. Okay, and we'll discuss what that means in a minute. For the substance abuses, low risk is 0, moderate is 2 to 6, and high is 7 to 12. And yours is at 25. Okay. So it's okay. It's okay.
I
Don't
would have thought I had more of an alcohol problem rather than substance abuse.
Right. So this is a good reason why we do these kind of assessments, because we don't know. You're just having a good time. You're not, you know, day to day categorizing what you're doing with all of this stuff. Um, they're both at a high risk. They're both dangerous. We think that because substance abuses are illegal, they're more dangerous. That's not the case. Food is legal and it's very dangerous, as we see through, our, obesity problem. So I don't want you to think of it that way. What I do want you to think about is some of the changes that maybe you would want to make. Um, your alcohol is on the high end of high. Your substances is double that. But I think the reason that your substance is so high is because you've basically had experiences with all of these except for crack in the last 3 months. So one thing I want you to be concerned about is the fact that although substance abuse is not worse than alcohol, what is worse is the mixing of all of these things. um those are the instances where people stop breathing when they're sleeping, not because they were doing anything extra, but because they had a lot of drinks and they took you know more than prescribed sedative, and your respiratory is gone. So I would suggest, and I want you to come up with we're going to come up with one or two, maybe three things, small changes that you can make, promises that you can make yourself, not things that are going to, you know, increase your anxiety and make you feel like you need. These are small changes that'll make a big difference. So I'm gonna have you come up with the first one, and then we'll work it out together. What's one change that you can make that you feel won't be too stressful for you, but you feel will be important?
Well, I take the ecstasy pills when I'm behind on my house cleaning and my
Okay.
studying, and it helps me to stay up all night and catch up. So
Okay.
I feel like that's the first thing that I can cut out and
Okay.
maybe manage my time during the day so that I don't have to play catch up and be up for, 24, 48 hours trying to catch up.
Okay. So we got a two-parter. So we want to eliminate. You want to completely eliminate
Yes.
the ecstasy use. That's great. I applaud you on that. Um, and you said you use it because it helps you to keep up with your house cleaning and your work.
Yes.
Okay.
It allows me to stay up when I would have been asleep and couldn't do the work.
Okay. Okay. And you feel like you're going to try to organize your time better?
Yes. And then I feel like the things that I don't have done, they're just not going to be done. I have an overwhelming feeling to get everything completed. So if I know that I'm going to X out the ecstasy, it's not going to be there to help me, then I'm going to have to understand that everything won't be done in one day.
Okay. And are you going to be okay with that?
Well, that's what I have my therapist for. If I start
Okay.
feeling as if I'm not, then I'll talk to her about that.
Okay. And I'm going to write these things down, and I'm going to make a copy for you to keep for yourself. And you can take it to your therapist if you want to discuss it further with her. We, at the end of these brief interventions, we sometimes want to set you up with a therapist. Thank God you already have somebody that you trust. If you didn't want to do that, you could continue to come and talk to me or one of the other behavioral health consultants. But thank God you have someone that you can lean on and that you can trust. Okay. I like your first goal is great. What else do we want to do? Let's see which other one was okay. I'm gonna look at the ones that were kind of high. Really just the alcohol and the marijuana. The others, um, you seem to have a prescription for these. Um, which one do you think can make a difference in your actions and your behaviors in the future?
Well, I do have a prescription for something called Focalin.
Okay.
It's supposed to help me concentrate and pay better attention. At times, I don't take it because I don't like how it feels.
Oh, okay.
But I'm thinking if I can take that to help me be more productive,
Then you may not have need the
the
ecstasy at
ecstasy,
all.
yes,
Okay.
it'll help me with not having the desire to take the ecstasy to stay up for a few extra hours to get everything done.
Right. Okay. So you want to stay medication compliant.
Yes.
Okay. Yes. You have some psychotropic medications. And do you understand the importance of consistently taking your medications?
Yes, it's just that one of my prescriptions is $130 a month. So for me, it was easier for me to take it throughout the week, skip one day on Wednesday, skip the weekends to try to stretch it. So I don't know if that's causing a big issue, but it's just I have to do what I can to maintain
Right.
my budget.
Well, let me point out how much is ecstasy.
Well, I've been getting ecstasy for $2 a pill.
Oh, well, okay. I can see that is why you would lean on that. But you do have insurance, correct?
Yes.
From that's provided through your employment.
Yes.
Is it not covering it
It covers
enough?
a small fraction, and the medication may be upwards of 300 some odd dollars. With my insurance, it's 128. And I joked at first saying, "Oh, it's going into my weed stash."
Right.
But every month I have to tell myself, "No, you need this to help you stay focused so that you can
Right.
accomplish your goals." But
Right.
it is difficult with the amount of money it costs for that one prescription.
That's a lot. I mean, I'm hoping that maybe there's some type of breaks or something you can get. The Falkland's been working for you, so you don't want to change prescriptions, I'm sure. But maybe that's something that we can discuss with your psychiatrist or your PCP to see if there's any type of discounts that you can get for that.
I
I
will tell you with the Focalin, on the days that I take it, I don't drink. So On Wednesdays, I don't take it.
Oh, okay.
Saturday, Sunday. So as you see,
So you have specific days that you don't take it.
yes, just to kind of stretch the pills.
Okay.
So I'm thinking that, and I know that on those days that I don't take it, I consume more alcohol because with the Focalin, I can't consume the alcohol because it gives me a bad headache.
Yes, and because it's an ADHD medication, one of the reasons why you're drinking more when you don't take it is because the ADHD medications, a lot of them are stimulants. But if you have ADHD, that stimulant is not strong enough to give you energy. It brings your energy level down. So if you're not taking your ADHD medication, then you're up here and you probably would want to drink more because alcohol is a depressant. So maybe that could help in the long run of affecting your alcohol use in a positive way. So we have these two. You're going to eliminate the ecstasy use and try to get more organized and discuss that with your therapist. And you're going to try to stay medication compliant with your Focalin.
Yes. So no more skip days on Wednesdays and the weekends.
Okay.
Because the amount of money that I'm spending on liquor to compensate for how I feel, honestly, if I would just, choose to dissolve that.
You think it would balance out a little bit more?
Yes.
Okay. Okay. I think that these two goals are great. I think that you will probably see some positive changes in your life if you stick to these two. What I would suggest is that, you taking this to discuss this with your therapist. I'm going to give you a copy, and me and you are both going to sign it. It's going to go in your record, but really it's just for you to have so that you'll have something to put on your fridge and look and be a reminder.
My promises.
Yes, because we get caught up in our lives and, we say one thing and we really mean it at the time. And then life happens and we just let it slip by. So I'm going to have you come over here and sign this. And I'm also going to give you a copy of just your results. Just have you sign right here. And I'll make you a couple copies, one for you, one for your therapist. And then after, 30 days, 60 days, 90 days, if you feel like you're ready to move forward, you and your therapist can set another goal or two.
Okay.
Okay?
So you think in 90 days I'll be okay with kicking my ecstasy? I mean, and I hate to try to downplay it, but it's just every blue moon when I'm tired and I just need that boost.
Mm-hmm.
And I use it just to kind of be purposeful. Some people use it and they just want to be addicts. But for me, I feel like I want to get my work done. I want to have that energy to stay up, and I just don't have it as I've gotten older.
I understand. But you know what? You are a creative person. You have to be creative in your job. And sometimes it takes for us to be creative to think of new ways to get the results that we want. We don't want to see you back in here unless you're just coming to say hello. Thank you so much, Miss Napoleon. I'm so happy that me and you got a chance to talk.
Dr. Hamilton, I just want to tell you that I appreciate this conversation. I don't feel attacked. I feel very open with you. I don't feel judged, and I really appreciate that. You're doing a great job.
Thank you. And I'm going to give you my number, and you can call anytime you want. Okay?
Thank you.
Thank you.